But before we get into effective communication and conflict resolution, I want to talk about this show on Netflix called The Resident. And I want to understand why no one has mentioned this show to me. I'm just now learning about it. I'm 2 seasons in now, so I gotta finish watching it. It's when I'm just so addicted. And the reason being is that's why it's important. If you are not educating yourself on what these things are and not asking the right questions, or if you are asking the right questions and your provider is not giving or is just brushing you off and not taking your question serious, or not taking your pain serious, or not taking your concern serious, this is where that bias comes into play, and this is where that mistrust comes into play.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started.
Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. So this is week 3 of our NURS 201 Introduction to Nursing Leadership, and we are going to be talking about effective communication. But before we get into effective communication and conflict resolution, I want to talk about this show on Netflix called The Resident. And I want to understand why no one has mentioned this show to me. I'm just now learning about it. I'm 2 seasons in now, so I gotta finish watching it. It's when I'm just so addicted. And the reason being is because some of the topics, well, let me be clear. Someone had mentioned another show to me on Netflix that's supposed to be, I think it's physician based, or it's written from the eyes of physician, or I can't really remember, but I was looking for that show because they mentioned how it was very realistic. It was not like some of your other shows. I won't name them. I don't want to offend anyone, but it's not like some of your other shows. And I actually found this one, The Resident. And I actually like this show. And the reason I like it is because to me, it's very, very realistic to I'm referring to the politics. The politics that you see that goes on behind the scenes is patience over politics. I'm so drawn to the show. I can't even get it out. Season 2, episode 20 was about a young lady by the name of Kira. Kira apparently passed away in 2016 after childbirth. Now, the reason why this hit home for me was because of the bias that took place and that could have possibly saved this young lady's life. And she was a young woman. And when I looked at her age, I was like, this lady's around my age. The young lady, Kira, C-section, and it sounds like her, and if I'm remembering the story, something happened with her bladder that caused her to hemorrhage. And the resident mentioned something to the nurse, and the nurse had never followed up. The resident also followed up with the surgeon who delivered the baby, and there seemed to be no sense of urgency. And the only person who seemed to have or experience some urgency was the resident. And when you see how there was just this lack of sense of urgency with the patient, and the resident said, he called him out. He said, I've seen you do more for females in the ER who's had less symptoms. Now, this young lady was experiencing pain. She had bloody urine. Her Foley wasn't, and it was showing, it flashed to her Foley, which was bloody red, and then it flashed to her Foley again, and it hadn't moved. And she was having a lot of abdominal pain. And when they took her back to the OR, as soon as they cut her open, it's like blood just went everywhere. They couldn't find the source of the bleeding. And then I guess they found the source of the bleeding. I'm like, yeah, I'm going through the episode, right? But it was so intriguing to me. And of course, I'm a nurse, right? So I find these things intriguing, especially when I see the bias. Like it was, Confessions of a Nurse Executive, right? The conscious and unconscious bias in healthcare. So for me, I identified right away what's going on, especially when they flash to the chart, they had the electronic medical record open. And when the resident was asking the nurse about the patient, and when it flashed to her chart, and like right at the top of her chart, it said African American. Now, does it normally just say that this chart just flashed across like African American? Not necessarily. I guess for the purposes of the scene and what they were trying to portray, it showed that she was an African American woman, and there was just no sense of urgency. When the last time the nurse had checked on the patient, again, the nurse said that she had been busy. And then when a resident looked around, he saw other nurses playing with other patients, or, moms who were being discharged. And the nurses might have been busy in a moment, but after your busyness was over, did you go back and check on that patient? Long story short, Kira unfortunately died, and she experienced, what we consider a never event. Right. What ended up happening was the hospital ended up putting protocols in place. And this is how the scene played out, but they put protocols in place as a action plan so that something like this wouldn't happen again. So there were protocols in OR, there were protocols for postpartum, there were different protocols that the episode walked through that they put in place after it happened. And it was inspired by a true story. So it's a very unfortunate event. And unfortunately, these things like this happen. And they were sharing statistics during the episode, which are true. So I just want to share some statistics with you. And I may have shared leadership representation with you guys in the past. Despite comprising nearly 7% of the U.S. workforce, only 4 Black women have ever led a Fortune 500 company, underscoring significant underrepresentation in top executive roles. And this was a story by the Cleveland Clinic, despite the focuses on diversity, equity, and inclusion. Now, and this is why, and I think this is why some people are saying, well, you know what, remove DEI, it doesn't really affect me. Well, it's still important, and I'll get to that. And it just goes to show you that we're still experiencing these things, no matter how many competencies you put in the workplace, no matter how we're still experiencing microaggressions and biases. Considering, as we were just talking about the episode, maternal mortality, Black women are approximately 3 to 4 times more likely to die from pregnancy-related complications compared to white women. Breast cancer mortalities. The mortality rate for breast cancer is 40% higher in Black women compared to white women. And this was in a public health law article. And we talk about ovarian cancer detection. For ovarian cancer detection, there's a test, there's a CA-125 test, and it's commonly used for ovarian cancer detection. And it's 23% less likely to indicate elevated levels in Black patients at diagnosis, potentially delaying treatment. So these disparities, they really underscore the urgent need for systemic reforms to ensure equitable healthcare for Black women. When we talk about the CA-125, I was in church this past weekend, and the gentleman shared his testimony. And for those of you who are not a person of faith, listen, you don't have to listen. I'm not trying to put my faith on you. It was what resonated with me. Obviously, I'm a nurse, and this was a gentleman who shared his testimony during service. And he talked about the CT calcium scoring test. Now, if you haven't heard about what this test is, and I'll share a little bit about what his story is so you can get an idea. Now, the CT calcium scoring test is a non-invasive study used to measure the amount of calcium deposits in the coronary arteries. And the results should be anywhere from like 0 to 400. And the gentleman in church, his level was something like almost 3,000, if I believe he said he shared. And so he ended up undergoing surgery. And this test saved his life. He actually heard on the radio is how he went and asked his primary care physician about ordering the test. He asked his primary physician if she would order the test, and she did. And at first she was saying, well, you don't need that. And she ended up ordering it anyway. And his test results came back at like 3,000. He ended up having surgery. And basically, he has a history of hypertension, diabetes. He said he works out, he eats well, but he has all of these comorbidities. And guess what? He had blockages. He had all these blockages, which was just a ticking time bomb. So when we talk about things like hustle culture, when we talk about things like Justin Grant being the keynote speaker at the Health and Wealth Expo Live Summit, where he's going to be talking about a wellness guide for Black men in corporate America. And what happens is a lot of times we don't take care of ourselves, and sometimes you don't know what you don't know. This gentleman heard about this test on the radio. No one ever thought to offer this to him. His doctor wasn't going to offer this test to him. He actually suggested this test and it saved his life. Now we're seeing so many people dropping dead, right? We're seeing so many people dying at such a young ages. And we're like, this person was 51 years old and they died. And we're like, what? Massive heart attack. What? Or 47 years old or 55 years old. And we're wondering why are we dying younger and younger? So think about some of the statistics that I just shared with you, right? So when we think about bias in healthcare, we're not getting educated. And then we're also not educating ourselves either. I do say we don't know what we don't know. And if we're just used to certain diets and practices are learned behaviors. So if we grew up eating fat, grits, fried everything, we're going to continue to eat like that as we become adults. And if no one's educating us and telling us what good foods looks like, healthy foods look like, fresh vegetables look like, and what do they do with their vitamins? I mean, with my IV hydration vitamin therapy business, we offer weight loss services, right? We offer wellness services. That encompasses a holistic approach to health. So we talk about what you're eating, we talk about what you're drinking, we talk about the vitamins and what the vitamins do for you. That's why it's important. And if you are not educating yourself on what these things are and not asking the right questions, or if you are asking the right questions and your provider is not giving or is just brushing you off and not taking your question serious, not taking your pain serious, or not taking your concern serious, this is where that bias comes into play, and this is where that mistrust comes into play. So this is how it all plays out, and this is what happens. So I gave a very long version of why I like this show, but it's very, very relevant. Some of the topics that they talk about, like I said, in politics, some of you may be asking, why do I talk about so much politics on the show? I mean, I some of it is just somewhat comical to me, even though it's not, because it's kind of serious what's going on. And I say it's comical because a lot of it are just distractions. Like they're huge distractions to get us distracted off of what's actually going on in the government. And I talk about politics only because the hospital system is a business, and there's a lot of politics that goes on behind the scenes. There's a lot of bureaucracy, and it reminds me of what takes place. It reminds me of what I went through. Like I've been there, I've done that. So it's all relevant. And this is also why I wrote my book, Confessions of a Nurse Executive. And this is why the subtitle is The Conscious and Unconscious Bias in Healthcare, because these type of things really do happen. And we need to know what's going on behind the scenes. This is how it plays out, and this is how our communities are affected. And this is what I talk about in my book, Confessions of a Nurse Executive, Conscious and Unconscious Bias in Healthcare. And I think this is why I'm so drawn to this show, because what I see taking place in these episodes, it really takes place. This is why I advocate, because the bias of what was experienced, what I experienced at least, led to burnout, because you're consistently trying to prove that you need to be at the table. And maybe I'm speaking for myself, right? You're consistently trying to prove, well, let me go get this next certification. Let me go get this education. So before you know it, I'm intelligent, right? And then I also knew no one could take that away from me. No one can take my knowledge away from me. No matter how hard you would try, no matter how hard you would make it seem like I didn't belong at the table, you can't take it away from me, right? So no matter how much sabotage, no matter all of the things that happened to me, and I'm sure it's still happening to other folks, no matter how much you try, you can't take away my knowledge. And because I'm knowledgeable, I'm able to recognize what you're doing. And it's that much more comical to me because I'm like, really? Okay, I've seen you already. I've already dealt with you, and I know how to deal with you. And we're going to talk about that. We're going to talk about, so today is week 3 of our NURS 201 Introduction to Leadership. And we're going to talk about that. We're going to talk about how do you deal with conflict in the workplace and your leadership communication and what that should look like. One of the most powerful tools that you can use as a nurse leader is active listening. A lot of times we get this confused, and we listen to respond and we don't listen to truly understand. Sometimes being quiet is the best thing that you can do, because when we respond, sometimes our first response is not our best response. It can make you lose your power. When someone doesn't know what you're thinking, you're still in control. If they don't know how to take you, they don't know how to receive you. They don't know if they rub you the wrong way or if not. And a lot of times you just have to be silent and just wait your turn. And what I mean is you don't always have to say something or respond right away, even to emails. You don't always have to say something and respond right away. Your silence and your active listening, listen to what's going on around you. Because sometimes something can just be misinterpreted. Or when you know you're not misinterpreting it, and when you know you're right, give yourself some grace to not respond. I'm just going to switch gears for a second. If you're a nurse leader and your staff member, they come to you and they tell you that they're feeling overwhelmed, maybe you start by acknowledging it, right? One of the first things you want to do is acknowledge it. You acknowledge the fact that, okay, I hear you. I hear that you're stressed. Maybe it's with their current assignment. Ask them how they can make it more manageable. Because this approach, it fosters trust and collaboration rather than defensiveness. And I'll give you an example. Something that I used to always say to my staff is, and I think this might be like a leadership thing because I don't think I was the only person who ever said it. And let's use an example of a patient experience. Maybe I went to them or maybe they came to me and they would tell me what was going on with the patient. And as soon as something would trigger me for patient experience, right? So the first thing I would say to them is, what do you think you could have done differently? Not realizing that I was putting them on the defense rather than hearing them out. Now, when it comes to my staff now and me as an entrepreneur, I listen. I don't always respond. Like even, and my staff now are independent contractors, right? So I have independent contractors who work for me. They work for the company, right? But when they have a concern, I'm not like, well, what do you think you could have done differently? No, these are grown adult women, right? And I'm not always just quick to respond because sometimes I'm wrong with what I'm thinking. And the more we communicate, the more I have a better understanding of what's taking place. So my point is active listening can be very important twofold. One, so that you can have a clearer picture of what's happening. And then two, sometimes you just don't need to respond when you do see what's happening. If you're picking up what I'm putting down, let me know. The second thing I want to talk about is navigating difficult. And this is how you navigate those difficult conversations when it comes to staff or even administration. Now, let's use the example of addressing underperformance. Now, there's a method called the SBI method. It's the situation, behavior, and impact method. And it helps you to stay objective. Let's take the situation, for example. Situation during yesterday's shift. You're coming with facts. Situation happened during yesterday's shift. During yesterday's shift, it was documented that the patient asked for pain medicine, and it looks like they received it at 5:00. Can you share with me what time the patient actually asked for it? Now you're giving them a situation during yesterday's shift, right? You're giving them a situation and you're giving them facts. And then you're asking a question. The behavior, I noticed the patient documentation was incomplete. The impact, this could affect patient safety and compliance. So then you want to follow up with an open-ended question. So you see what I said? Can you share with me what time the patient asked for the medication? Situation, during yesterday's shift. Behavior, I noticed the patient's documentation was incomplete. Impact, this could affect patient safety and compliance. I want to follow up with an open-ended question like, help me understand what happened. This encourages dialogue and problem solving as opposed to you didn't do this and you didn't do that. It discourages defensiveness. So it's important to be able to hold conversations and, get to the bottom of conflict. If ineffective communication can really damage and hurt relationships, and it could really lead to misunderstandings. You could be misunderstood. And again, I can share this with you guys because I've been there. You could be very misunderstood. Miscommunications are going to occur and you have to know how to deal with them. And then especially as a leader, you have to be able to handle what you believe is going to be conflict. Something I would run into is, especially with managing newer charge nurses or newer nurse leaders, they were not prepared to handle difficult conversations, even things when it comes down with the schedule. Like, they didn't want to do the schedule because they didn't want anyone being mad at them. As a leader, you have to understand that you're not going to make everyone happy. That's number one. Even in business, I was at an event the other day, and she's the owner of a winery, a huge winery in Pennsylvania, and she mentioned that sometimes her employees come to her, and she said sometimes she has to make decisions, and one of the things she said is she hired people, she put people in place now so that she doesn't have to be the person to always be the bad guy. Which is hysterical to me but I mean, as the leader, you're not always the bad guy. However, sometimes, and again, if you don't have those good relationships, and even when you do have good relationships, you're going to have to make those tough decisions, and you're going to have to make those decisions that you're going to have to live with. But communication is what's going to be key in making those decisions. Now, you're going to have some people who their minds are already going to be made up on who you are, what you do, what you stand for. And that's okay. You're going to have certain situations where people may just already have a bias against you because of who you are, the way you look, and what you stand for. So you're going to have to be able to navigate all of those situations. But the first thing, it starts with you knowing who you are. And when you know who you are, no matter what they say, no matter what you do, you're living your truth. And when you walk in your truth, no one can take that away from you. No one can take away the facts of who you are and the way you handle the situation. When you deal in facts, you deal in truth. And the last thing I want to talk about with leadership is interviewing. So I want to talk about some interviewing tips and some resume tips for climbing the leadership ladder. When you're preparing for leaderships and interviews, please do not come dressed in shorts and your hair not done. And Amanda Jackson is going to be our HR consultant at the Health and Wealth Expo Live Summit, May 15th and 16th. And she has her own consulting business. She's been working in human resource consulting for many, many years, and she has her own HR consulting firm, Lowe's Consulting. And I actually was talking with her because my son wears braids, and we were talking about the braids thing. Like, what do you think about braids going to an interview? Should we do it? How does it make you feel? What do you think? And she said, I actually don't have a problem with braids. She said, as long as they're neat. Now, I come from an era where you came to your interview, you were clean cut, but I noticed different generations, they come to interviews differently, and you have to accept that. So you have to accept the different generations. However, there's still a level of the type of job that you're coming for. You still want to show up like you're coming for the CEO role. And this is what I mean. I remember one time, and I'm sharing this with you. I remember one time my son was home from school for the summer. He was home from school from the summer, and he was going for a job interview, and he was going for a job interview. And I was like, where are you going? He's like, oh, it's a construction job. I was like, no, you put on some khaki pants, a nice polo shirt. You still go to the job and show up like, you show up like you want to be chosen. Make sure that when you show up, your appearance, your clean cut, clean shoes, don't have dirty nails. As someone who still interviews now, I look at these things. These things are being looked at. So you are being looked at by your appearance. Trust me. But it looks like they're doing a lot of digital interviews now as well, too. A lot of online interviews. So make sure that when you are turning on that screen from the head up, you are clean cut. Make sure that you're ready and you're presentable. One of the things that you want to start considering when you're doing an interview, if you've never heard of the STAR method, you want to use the STAR method. Don't just come and interview with me telling me how great you are and why I should hire you. Give me examples. And a great way to do that is by using the STAR method. You want to use the situation, the task, the action, and the result. And I'll give you an example. During the staffing crisis, right? That's the situation. I led the scheduling team, which was the task, to develop a flexible rotation plan. That was the action, resulting in a 20% decrease in call outs. That was a result. So you get what I'm saying? So you take something that you've done and the situation, what was the task, what was the action, what was the result? This is what you want to use when you're interviewing. And this works no matter what role you're applying for, whether you're a new grad nurse a new grad healthcare professional, whether you're going for a leadership role, you're advancing, that works no matter what role you're applying for, because people want to know what you did, what was the situation, how you handled it, and what was the result. So always keep that in mind when we talk about leadership. And just some resume tips for you. With your resume, something that they're doing now is they're putting pictures on the resumes, and they're no longer putting home addresses on the resumes. I'm not sure if you guys knew that. And again, I know this from having HR consultant friends and colleagues who are sharing this with me. So that's something that you want to consider, that we're not putting your home address, and that's more for safety reasons. If you want to learn more about health HR consulting, join us at the Health and Wealth Expo Live Summit taking place on May 15th and 16th. You can log on to healthandwealthexpolive.com. It is still your chance to register. By the time this airs, early registration will be over, but make sure that you register for the event. You do not want to miss it. It's a 2-day event. You can come both days. You can come one day. Your registration is your entry to both days, and you can choose to come one day, or you can choose to come both days. That is all. We're going to wrap up today, and I do want to share this. We have to finish our last class. What you can look forward to in week 4, we're going to be talking about our breakthrough. Right. We're going to talk about we're going to go over your career breakthrough blueprint. But before then, I got to give you your homework. On week 1, we completed your leadership self-assessment, identifying your personal strengths and weaknesses. And week 2, we looked at your leadership development plan and steps to strengthen your leadership skills. This week, we talked about your career growth and communication. All of these are important, whether you're looking to go into leadership or whether you're looking to go into entrepreneurship. This is why I always say nurses are natural born leaders, because you can take these very same skills and you can transition them into your entrepreneur journey. Next week, we're going to talk about entrepreneurship, and we're going to talk about breaking through in your career, whether you want to go into nursing leadership or whether you want to go into entrepreneurship. Just to recap on your homework for this week, is to continue developing your leadership development plan. So be ready for next week for our last NURS 201 leadership development course. I hope you're enjoying this as much as I am. And if you want, and before we go, as we wrap up, I do want to mention that over the next few weeks, I'm going to be doing a special series called Nurse Shift Change. I am on a committee full of nurses who are looking to take our power back. We're looking to give nurses a voice, and we're looking to have a rally on May 24th. So more to come. I'll be meeting with these nurses over the next few weeks, and you'll be hearing them talking about their background, the impact they're making in leadership. And we are going to be doing a podcast series, a LinkedIn Live series, all leading up to the rally that's going to be taking place on May 20th. You all are also welcome to attend the expo in May 15th and 16th. That is our extended Nurses Week celebration, where we'll be talking about nurse business development, empowerment, self-care, wellness. When you think about what's going on with all of the uncertainties in the government and healthcare, it is really time to take your power back. And how can you position yourself? One of the ways that you can do that is you can position yourself by starting a nurse-owned business. And what we're going to be talking about at the summit is how to monetize your expertise, nurse business development. It's going to be a medical writing workshop. It's going to be a workshop on creating a business plan. We're going to be having how to start a mental health practice as a nurse practitioner, real estate development. And we're going to have a roundtable discussion on DEI and what that looks like, and a lot of the topics that I talked about at the start of the episode. By the time this episode airs, I know it's Women's History Month is going to be over, but I want to leave Women's History Month with talking about Ella Baker. I talked about Ella Baker on my Mentorship Monday on LinkedIn. Ella Baker was a pioneer. She was a woman who believed in leadership from the middle out. She believed in middle out leadership, because I want you to start thinking about drawing inspiration from middle out leadership. Ella Baker, she was a pivotal figure in the civil rights movement. She really empowered everyday individuals to collectively challenge and dismantle systems of oppression, including sexism, racism, and classism. In nursing and in healthcare, we often encounter challenges that test our resolve, and it's crucial to remember that no external force can diminish our intrinsic value or define who we are. So I'm going to leave you with that. Until next time, make sure that you stay educated, stay inspired, and stay empowered.